Basically, what these data indicate is that with this 5 years follow-up, the experimental arm, so brentuximab vedotin ABD, is superior in front of ABVD in terms of this modified progression-free survival in the global population of patients, and also independently on the response that the patient achieved after 2 cycles of chemotherapy evaluated by PET-CT. And the biggest differences between both arms were seen in those patients that were PET2 positive, that basically represent high risk or a poor prognosis population of patients. So these are the data regarding efficacy. Another important thing, of course, when trying to introduce a new treatment strategy is to look at toxicity and side effects. So the most important toxicity of brentuximab vedotin ABD is peripheral sensory neuropathy, that at the time of this analysis was resolved in more than 80% of the patients. And in the population of patients that still presented some degree of peripheral sensory neuropathy, it was basically grade 1 or 2. So really degrees of peripheral sensory neuropathy that did not had a significant impact on the daily life of the patient. So let's put it this way. And another important thing that it's going to be reported is the potential long-term side effects of first-line chemotherapy. So being patient with classical Hodgkin lymphoma, young population of patients, infertility related to the administration of first-line chemotherapy is really of importance. And the investigators will be reporting non-different numbers of pregnancies in patients belonging to both groups of patients, so both groups of treatment. So basically the summary is that these 5 years follow-up basically give consistent results in terms of efficacy, of course more solid over time, with the same known safety and toxicity profile, and with really a low proportion of patients having significant peripheral sensory neuropathy after 5 years follow-up.